As we take a short break between seasons of Muddy Paws and Hairballs, we're bringing back one of the most essential episodes for every pet parent: Pet Vaccination Essentials. Vaccines are a crucial part of ensuring our pets live long and healthy lives, but I've learned through my own experiences that understanding them fully can be a little more complicated than I once thought. Like many pet parents, I always used to follow a pretty standard vaccination schedule, but as I've learned more, and especially having conducted this interview with Dr. Jeff Grognet, I've had to reconsider and educate myself more on the latest guidelines and the unique needs of each of my pets. In this episode, we dive into the core things that every pet parents need to know, whether it's determining what vaccines your pet really needs or understanding the risks of not vaccinating. I wanted to bring this episode back because it's so crucial to make informed decisions that are in the best interest of our pets. Whether you're new to pet ownership or you've been in the game for years, this episode has information you can use to make the best choices for your pets. Stay tuned for expert insights and personal tips that'll help you navigate the world of pet vaccinations. Today, we're going to be talking about vaccinations for your pets. And my guest, who was actually a guest very early on in the show, Dr. Jeff Grognet, is a practicing veterinarian and an award-winning author. With over 40 years in practice, he's been actively teaching for 35 years and has taught over 42,000 students wanting to create veterinary assisting careers. He has developed courses on pet first aid, behavior and training, as well as holistic therapy. Dr. Jeff has a passion to teach owners how they can better care for their pets from a holistic standpoint. He focuses on nutrition, minimizing vaccines, and reducing toxin exposure. So, Dr. Jeff, thank you and welcome back to the show.
Thank you very much, Amy. It's great to be here. Great to get the message out.
Yeah, definitely. And I obviously I get your emails, and so I've seen all the information and the classes that you've been having about vaccines, and I thought this is going to be a perfect topic for a perfect expert to help us kind of get some things straight, because I think pet parents are very confused and kind of don't know who to believe when it comes to what our pets need from the standpoint of vaccinations. So one of the things that has come up is the idea, and I had never heard the term before, except for in the past couple of years, is, core vaccines versus non-core vaccines. What does that mean?
That sort of moniker for the vaccines came out when they developed vaccine guidelines. And so core vaccines are the ones that are considered the life-threatening, quote, common diseases that, in this case, cats and dogs can suffer from. And so the core vaccines, the guidelines suggest that they should be done in all cats and dogs. The non-core vaccines, differently, are ones that are, you can call them optional. And what they say with those is that it depends on the risk and the exposure and what the pet is going to be exposed to, as in what they may come down with. The definition of core and non-core is strictly a conventional mechanism, and that is it's just how they break down the vaccines. And there's also some confusion on what should be labeled as a core and a non-core vaccine. And for example, a little while ago in California, they put leptospirosis as a core vaccine in some areas because they were seeing more cases. So because of that, all of a sudden lepto became, quote, a core vaccine, according to those veterinarians in that area. This is not something that is regulated. Is something that veterinarians will sort of come up with, I'll call it, by themselves. And what it does is it creates, the idea of calling it core creates an urgency that you should get that vaccine done. It doesn't change the facts of the problems with vaccines, how often you really should do them, that type of thing. But it is used as a moniker for saying, oh, these are the important ones and we've got to do them on this regular schedule conventionally.
Okay, got it. And so, for years and years, it was, every year you go to your vet and every year you get this barrage of vaccines. And it seems like nobody ever really questioned it. But I think this issue is coming up because we actually have been finding that we are over-vaccinating our pets and that there are risks associated with that. What kind of risks do our pets face when we over-vaccinate?
Yeah, I wouldn't even call it over-vaccinate. I'll just call it vaccinating. Because as soon as you say over-vaccinate, then it's sort of, well, what do you mean by that? No, it's just vaccinations can cause problems. And the one that's recognized universally, of course, is allergic reactions. You give an injection of a vaccine, and they can have a life-threatening reaction. I always think of it as in the 10-year-old kid who gets a peanut and they have an allergy, and then they end up going to hospital. They can have those life-threatening reactions. The most common allergic reactions are the ones where the face swells up, and so the muzzle gets really thick, the eyelids swell, the ears get thickened. And in those cases, it's like, oh, okay, we've got an allergic reaction going on here. And then another one they can have 12 hours later, 24 hours later, is hives. So they can have little bumps all over their body, which are very itchy. And so that's the allergic reaction. That is the thing that is recognized by all veterinarians as in, oh, that is a direct vaccine reaction. The other ones that occur are ones that occur delayed. And the one that came to the forefront back in the 1990s was the ones, it's called a feline fibrosarcoma. It's a tumor that occurs at the site of an injection in cats. Now, that used to be called a vaccine-associated feline fibrosarcoma, but what they found is that it's due to any injection. You could have an injection of antibiotics, steroids, program flea stuff, and even microchips. They can stimulate growth of a tumor in cats. Okay, so that's not a direct vaccine effect, but it's an effect of the injection of the vaccine. So that cancer in cats, that was the thing that changed our whole thinking of, gee, vaccines are safe and effective versus, oh, no, vaccines are causing a little bit of a problem here. Okay, so that was the thing that changed the tide in vaccines, for real. The other things that we can see hemolytic anemia in dogs. That's where they start destroying their own red blood cells because their immune system's kind of messed up. We can also see bone inflammation. It's called hypertrophic osteodystrophy. It's where they get bone changes on I call it the fingers. And again, that's in dogs as well. But the other two things, and this is what's really pushed by holistic practitioners, is that there's two diseases that are rampant and they're really causing problems. And certainly most holistic vets would say, yep, vaccines have a role in this. And the two are allergies, which have so many dogs suffering from and generating huge bills because of medications that are used for that too. And the other one is cancer. We're seeing so much cancer now compared to when I graduated. The difference is night and day. And that's just in my time as a veterinarian. And so because of that, I think we have to sort of rethink our whole strategy on vaccination.
Yeah. And so how do we in general, and then maybe get into the specifics for individual pets, but how does one find that balance between protecting my pets from the obvious dangers and then not over vaccinating and figuring out what's the right schedule and for us to follow? Yeah.
That's about a 2-day webinar that I could do for you, Amy.
I'm quite sure.
But this is, okay, the first thing is, here's a simple one. It's based on the risk of the disease.
Okay.
And so let's take two. You've got an indoor cat. Feline leukemia is only passed on from one infected cat to another when they have a fight. An indoor cat does not need the vaccine for feline leukemia. That's real simple. When you have a dog and you're worried about Lyme disease, well, you've now got a 4-pound Yorkie that lives in your apartment with you, and you go out with it under your arm, put it down on a little bit of grass outside your apartment building, pees and poops, pick the dog up, go back in. Lyme disease is not a threat. That dog is not going to pick up a tick and get Lyme disease in his world.
Right.
So you have to look at the risk from that standpoint. The other side is, and this is what a lot of people don't even talk about, is that as you have animals that age, and what I'm talking about is puppy and kittenhood versus 3 years old, say. Um, Distemper in dogs and also parvo are puppyhood diseases. If you give parvo to an older dog, they will usually survive it. They do quite well. In the same way, cats with panleukopenia, which is stupidly called distemper, but it's also parvovirus, which everything is really get complicated on that one. But the point is, feline panleukopenia is a kittenhood disease. If you give that to an adult cat, yeah, they might get a bit of vomiting, might get a bit of diarrhea, but it's well known that if you have a pregnant cat, a queen that's pregnant, and they pick up panleukopenia during pregnancy, they will end up with birth defects in the kittens. They end up with this really wild nervous problem called cerebellar hypoplasia. And so the point is, they survive the infection just fine, right? So the big thing is that as they start to age, their immunity to the diseases gets so much better. And so even with the core vaccines, it's like, oh, if you have a 10-year-old dog or cat, they don't need the core vaccines anymore. They're not going to die from it. They're not kittens. They're not puppies, right? So there's a huge difference there. But the other side is, and this is the thing that's really come to light, is the effectiveness of the vaccines. And a great example would be dogs' coronavirus vaccine. And coronavirus supposedly causes a little bit of vomiting, diarrhea, that type of thing. When they did the studies on the vaccine that's available, what they found is that they couldn't actually create disease with the coronavirus virus in the control group. So therefore, the vaccine didn't prevent anything from happening.
Wow.
Okay. And so the case is that the studies kind of show that, well, what's it protecting against? Nothing. It's not needed. Okay. And then when we get into the leptospirosis vaccines, there's a lot of concern on that one. And two things. One is that quite often it doesn't produce immunity to the leptospirosis strain that the dogs are exposed to. But the other side is lepto and also Lyme in dogs are your most reactive vaccines causing problems. In cats, it's the feline leukemia one that causes a lot of the problems. So as you can see, we have to look at each individual vaccine. It's not fair to label every vaccine as causing huge problems.
Right.
There's specific ones that do cause some real issues. Some of them don't.
Yeah. So when a pet owner, because generally I think people don't do a good job of asking questions when they go to the vet. They go to the vet, and there's kind of two sides of it, right? There's the person that the vet says, Fluffy is due for XYZ, and you get it all done. And then you get the people on the other end, and oftentimes it's economic reasons that they say, well, I can't do all that, or I don't want to do any of it because my cat doesn't go outside. So you had mentioned the idea of your living situation being a major factor in deciding what vaccines you need. And then age of the pet, obviously that's going to play in. Are there other factors that I should consider?
Yeah. This is where you have to look at each of the diseases. Generally, most dogs can get away, and this is dogland right now, most dogs you can get away with not giving any of the non-core vaccines because of lack of efficacy and also concerns with reactions to it. The problems with a lot of the vaccines is they don't work that well, and the best example is Lyme disease. Over 95% of dogs, when they're given Lyme disease, they will just brush it off. You won't even know that they've had an infection. Okay, they might have a day where there's a little bit off, but otherwise, no. They don't have a problem there. They end up just getting rid of it. And like I say, most times you wouldn't even know it's Lyme disease. There's a very small subset, and this is what's really advertised in the veterinary world, that they can suffer from something called Lyme nephritis. It's a kidney infection kidney inflammation due to Lyme disease. But you also see the same thing happening if you vaccinate a dog. You can get Lyme nephritis from that. So it doesn't have to be the pure, the bug itself. So you have to look at all those aspects, as in, gee, is it really worth it? Should we be doing that? In Catland, there is a vaccine available, and I just want to throw this one out right now, for FIP.
Mm-hmm.
It's feline infectious peritonitis, which is a coronavirus. And the vaccine has been proven to not work.
Okay.
And if you look up the American Association of Feline Practitioners vaccination guidelines, it will say in there, vaccination for FIP is not recommended. That's the stuff that we should be following. And that is in the vaccine guidelines, which are created by the veterinarians that know what's going on there. But the real big thing about this, very simply, Amy, is we have to look at how long vaccines last.
Mm-hmm.
And the pioneering work was done back in the 1970s by a Dr. Ron Schultz. And what he did, he was a veterinarian, of course,
mm-hmm.
and he had this concept of, why don't we vaccinate dogs once, and I'm talking core vaccines here, so
mm-hmm.
distemper parvo, you vaccinate them once, and then you check them a month later to find out, did they respond to the vaccine? You do a titer. And if you find that they have produced an immune response,
okay.
that immune response means that the immune system is activated. We have memory cells in there, which persist for the lifetime of the dog. We do not need to do another vaccination, period. The same concept applies in cats with panleukopenia. Not so much with the respiratory viruses, because that's kind of like you and me with the flu virus, right? And that is, it's changing all the time. So it's very difficult to have 100% immunity to the feline respiratory infections. That's just rhino and caliche. But that's the fate of that one. You're never going to have 100% on it, because you can't vaccinate for every strain that's out there in the world. And the other thing is, cat and dog vaccines never change. They don't update the strains in the vaccines from year to year like they do with the human flu vaccine or the COVID vaccine or anything like that. Okay, so there's static vaccines. They were implemented, created decades ago. Okay, but the main thing is we've got them lasting longer. We don't need to vaccinate every year or every 3 years.
Well, and that actually brings up a question that I hadn't thought about before, is the whole idea of what is the deal with these 1 year, like rabies is one that is required in our communities here in Texas, even though there are very few cases of rabies that are out there. But obviously, when you get into situations where it's a disease that can transfer to humans, I guess that makes it a much bigger deal. But, it used to be you got a rabies vaccine every year. And then it's like, well, if you got it 1 year and then you get the booster the year next, now you can go 3 years. But is it the same vaccine? Is it a different vaccine? Or?
It is the same vaccine completely.
Okay.
The reason for the getting it done as a puppy or kitten, and then doing it a year later, and then moving to a 3-year schedule, is because that is how the vaccine was tested. Okay, so the vaccine manufacturer tested it that way, and what they said is that, okay, based on a 3-year interval, we have good protection, so therefore we can say it should be done every 3 years. It provides what they call 85% protection.
Mm-hmm.
It's not 100%. Okay, and that's the thing. Very few vaccines produce 100%, but in the case of rabies, 85 is the minimum for the 3-year duration. The kicker is this: you're not going to find a vaccine manufacturer who's going to do an expensive study with the goal to reducing their sales. It just doesn't make sense for them.
Yeah.
Okay. The one thing I do want to comment on, though, in cats, there has been a vaccine that was produced, which was, quote, purer than the original vaccines. And so because of that, it didn't have a lot of the gunk in there. And it specifically didn't have an adjuvant. Adjuvant is added to vaccines to bump up the immune response. So the key with that is that the adjuvants were originally were blamed for creating the higher instance of the tumor, the fibrosarcoma we were talking about.
Mm-hmm.
And so this vaccine was manufactured, but because it didn't have an adjuvant to stimulate immunity and it was brought on sort of quickly, it was only good for 1 year.
Mm.
So that one had that specific rabies vaccine had to be done every year in cats. This wasn't dogs; it was strictly cats. But what we now know is that the incidence of tumor is no different with the non-adjuvanted 1 year vaccine and the 3 year adjuvanted vaccine. And what we're doing is we're giving 3 times as many vaccine, which is just boosts up the number of the tumors that can actually occur.
Mm.
So very good reasons to avoid the 1 year vaccine and stick with a 3 year one if you have to do it. Unfortunately, as you mentioned, Amy, in Texas, but in pretty much every U.S. state, there is a requirement for rabies vaccination. There is something there and the number that I've got from this, and I don't know how accurate it is 18 states supposedly have exemptions for a rabies vaccine that you can actually apply for, so to speak.
Mm-hmm.
But that has to be done by a veterinarian. And what they do is they apply for an exemption based on the health of the animal, had past reactions to the vaccine or something like that.
Mm-hmm.
And certainly when you're dealing with a cat that's got kidney failure, you've got a dog that's diabetic or had cancer, like a mast cell tumor, things like that, it's kind of like, gee, do we want to give them any vaccines and mess up their immune system here?
Yeah, really.
And if the answer is no, that's what we're trying to avoid. We're trying to prevent that from happening. Like you say, the rabies incidence is really low. But unfortunately, because it's a human disease, then you get public health involved, and they're the ones that stimulated the rabies vaccination laws for the dogs and cats.
Right.
So very hard to get around that. Okay. And so because of that, unfortunately, we do see some areas where the rabies vaccine is really pushed. And this is one sort of thing I get, I guess, confused and concerned about, is that when did veterinarians become the police in the rabies vaccines for animals?
Good point.
As in, why are they the ones that are pushing this point when it's the law that should be saying it, and then it should be our option to say, hey, I'm not going to do it. I'm going to disregard the law. But but the veterinarians quite often get in there saying that we have to do it. So and it comes down to their liability, but I think it's a little bit misguided. I don't think we do that. It's the same thing with our medical doctors. Would they do the same thing to us? Good question.
Well, and I think, as far as the rabies goes, I mean, when it would ever come up is really when you're trying to do something like going to a boarding facility, going to a training class, whatever it might be, where there would be required proof of rabies. Because your average person who goes to the vet once a year, gets done what needs to get done, has their pet in their home and takes their pet everywhere with them and doesn't partake of those facilities, nobody's ever going to question whether their dog has a rabies vaccine unless it bites somebody. Then that's a whole nother ball of wax. But it's just not something that's going to come up.
No. If you're just walking down the street, you don't have people asking you, "Can I see your rabies vaccine before I pet your dog?"
Exactly.
So.
Exactly.
But anyway, yeah. The thing about that is that if you're pushed into doing any vaccines, and this is just a case of if you have to get vaccines done, there's also what we call remedies that are recommended to try to help that out. And specifically, when we're talking about the vaccines in dogs and cats, there's a homeopathic remedy called Thuja, and it's spelled Thuja. And that one is a general remedy that's used for vaccinosis to prevent the side effects of vaccines long term.
Okay.
And then if you're dealing with rabies, the most common one that's used is called Lyssin, Lyssin, because the rabies is a lyssavirus. That's where the name comes from.
Okay.
And so I mean, those are homeopathic remedies that are used a lot for, in a sense, like a detox.
Mm-hmm.
And so definitely if you're getting that done, that's something to consider as well. Okay.
Okay. So, kind of along that same line, for somebody that might be concerned about disease, but at the same time, maybe more concerned about vaccines, are there alternatives to vaccines to protecting our pets from some of these common diseases?
Okay. Well, there's two ways to go.
Okay.
One is to reduce the vaccines to a low number as possible.
Okay.
And the other one is to not use vaccines and use a different method. Okay. In terms of the different method, that's where we're talking about using homeopathic nosodes. And nosodes are homeopathic preparations made from the disease itself. It contains the virus. And then they're prepared in the homeopathic method of dilution and succussion, as they call it. And that is what's given to the animal. And this is the key. It doesn't produce an immune response.
Okay.
Okay, so you can't measure antibodies after you give them a homeopathic preparation. What you're giving them the homeopathic thing for is that they're at risk of picking up the disease. And what it does is it helps the dog or cat get through that without having any symptoms of the disease at the time.
Okay.
And if you want to get into nosodes, there's companies that sell them, both for dogs and cats. And you just look up homeopathic nosodes for canine distemper, or you look for feline leukemia or something like that. And what you can do is you can purchase them. What I found is that each one of them has different directions on how to use them.
Okay.
And so what you'll find is some say give it twice a week or something like that during the susceptible period, and then you give it once a month or something like that. They're all over the map on that. And so where you purchase it from, they'll be able to tell you how you should use it.
Okay.
But that's one method.
Mm-hmm.
The other way, and this is the one that I used at the hospital, is, and here's a very simple program for you, and I'll tell you what it is, and then I'll tell you how it works. What I was doing, for example, in dogs, is that I would see them as a puppy at 16 weeks. I see them before then, but the first vaccine and the only vaccine I gave was at 16 weeks of age. The reason we wait for that is maternal antibodies have come down. And so what happens is, as they go down, there's no interference from the maternal antibodies they got from their mother's colostrum. Therefore, they'll respond to the vaccine at 16 weeks. And 97% of puppies respond then. Okay, so we know that. So what you do is you give the vaccine, and this is a core vaccine. And then a month later, you do a titer. And a titer is a measure of the antibody in the bloodstream to that specific disease. And so, for example, we gave a parvovirus vaccine. A month later, we do a parvoviral antibody test, the titer. And if we find that it's gone up, the immune system's now responded. And that way, we also know we've got a clone of white blood cells called B lymphocytes, which are producing antibodies to that virus, and they will persist for life. And this is something that every veterinarian knows and learned in vet school, as in, immune system means we've got it for life. Just like me having a polio vaccine when I was a little guy, I don't get revaccinated when I'm 40 years old or whatever. There's no, it doesn't run out, right? So the key is it does persist for, as far as we know, a lifetime for the memory cells. So if the titer's proven that you got a response, there's two big things here. It means that, we've got memory there. We don't need to revaccinate. And the other side is we also don't need to do another titer.
Oh, okay.
There's no point.
Because I was wondering if that was going to be something you have to keep doing.
No, well, some veterinarians do that. Mm-hmm. And what they're doing is they're looking at the antibody level in the bloodstream and saying, once it gets below a certain level, we need to revaccinate. Well, it's natural for the antibody level to go down. But even though that antibody level may be close to zero, and it probably never gets to zero, it's just that the test can't detect it. But once it gets low enough, then they're saying, there's no immunity there. No. If you give that dog a vaccine, you're going to find that the immunity goes up in a heartbeat, like in a couple of days. like boom, you've got it. But the other side is if that dog picks up the disease, as in picks up parvovirus, when the level's gone down, the immune system's going to kick right into high gear and produce what's called an anamnestic response. That's a big word. But what it means is that the immune system's already in charge, and all you got to do is stimulate it that little bit with a disease or a vaccine, and the number goes right up, and it's protective, and they won't get sick. So that's the key. We can do one vaccine, one titer, and then we're done. Called one and done. We don't have to do it, keep going. Same applies to cats with the core vaccine as well.
We'll be right back.
Can we be real for a second? Vet bills can be brutal. One unexpected visit, and suddenly you're choosing between paying your rent or paying for your pet's care. That's exactly why I created the Vet Bill Survival Kit. It's free, and inside you'll find 10 proven ways to save money at the vet without shortchanging your pet. Download your kit today at petparenthotline.com/vetkit. That's petparenthotline.com/vetkit. Okay. So, and I kind of skipped over a question that I was going to ask you, but I want to get back to the idea of kind of traditional versus, that sounds like what a holistic veterinarian would take that approach versus a traditional. And I know there's a scale of people in between. It's not just one extreme or the other, but, from the one end where it's traditional, and this is just what we do. We give vaccines every single time until the dog dies or cat dies, versus the one and done approach. How is a pet parent to know what's the right thing to do? Or how do you, do I just go out and look for a veterinarian that has this approach over here? Or do I try to convince my veterinarian to take that approach? Or, because it kind of, we're not the vets. We're relying on their advice when we go there.
That's right. Yeah. And here's a few ideas for you. I'm giving this idea. Mm-hmm. And if I had a conventional vet right in front of me here, they'd be shaking their heads going, no. That's not what I can believe. This is the point. It's not what I can believe in. And so when people are looking at alternative vaccinations, they have to decide, what do they believe? What are they comfortable with? And this was really brought home with that, that virus thing that came out in people called COVID, that one.
Yes. We
got a complete dissection of the population in terms of what people believed about the disease and the vaccines.
Yes.
Okay.
Mm-hmm.
So we had people that were lining up to get vaccines because they really wanted it, and we had the other group that was saying, "Oh no, those things are dangerous," and and so. But the point is, you, as in you, me, and everyone else, are comfortable in going down the path that you believe is the right one to go into. Mm-hmm. And whichever one you go into, you can probably get backing for it. You can do research and say, "Hey, this guy agrees with my thinking."
Right.
Not that you're going in to change your thinking. You just get someone to back you up. And so the thing about it is this. I was born and raised a conventional veterinarian. When I graduated in 1983, we were vaccinating every year. Mm-hmm. And then when things started changing and we realized that vaccines are causing some issues here, and it was feline fibrosarcoma was the biggie. The allergies, that was another one. But then it's like, we got all these other little niggly diseases. Some of them are huge. And, vaccines just aren't as safe as we really believe. Mm-hmm. Other veterinarians will tell you, and the research papers only look at what happens in the first 3 days after a vaccination. Mm-hmm. They don't look at what happens after 3 months. So for that reasoning, sometimes it's very difficult to get the information that you really want. Mm. And this is the key. In practice, I would have animals that had a cancer. Mast cell tumor is probably about the best one in terms of dogs. And they've had mast cell tumor. They took off the left hind leg last year. And they're going, I wonder if I should get vaccines. And my recommendation was, no, I think we should avoid them. Thankfully, we do not have a rabies vaccine requirement where I live. Mm. Okay. But anyway, I would recommend no. But so many times I had animals that had cancer and they were vaccinated as I call it, at elsewhere vet hospital. And a month after that vaccination, they've got a lump that just appeared.
Mm-hmm.
Now, was it going to appear anyway? Don't know. But it just seemed to happen a lot more often than I really wanted it to. The one that really shows up is when you have dogs or cats with allergies. If you vaccinate them, their allergies will get worse. You're mucking with the immune system. You're stimulating it. And so, and most even conventional vets will go that route. They'll try to avoid doing vaccinations during that dog or cat's allergy season. Okay. And I just want to hit one thing in terms of allergies and such.
Sure.
When we have a dog or cat that has a reaction to a vaccine, the approach that's quite often used at that point is that, on the next vaccine, what we're going to do is we're going to give an injection of Benadryl about, say, half an hour before, and then we'll give the vaccine, and then hopefully that will prevent any reaction.
Mm-hmm.
Well, if you had a reaction before, it could become life-threatening later. And are you going to take the chance on a shot of antihistamine that's going to prevent the death of your pet? The vaccine isn't that important. You can avoid giving it because we know it lasts longer. We don't have to do it every year or every 3 years. And so therefore, trying to give something so we can get the vaccine in, we have to look at what's important here. That's the key. Okay.
Yeah.
But veterinarians are unfortunately, I'm seeing a trend backwards.
So I live in a small town. It's somewhere in the world, and there's one veterinarian in town versus in Houston, I could probably seek out a veterinarian that had my beliefs and, work that way.
Right.
What would you suggest as far as a pet parent having those conversations? I mean, first of all, you have to have the guts to stand up and say, I have concerns about this, but what else can we do to have that conversation with our vets?
Well, a big part of it is that it depends on the veterinarian as to how receptive they are any conversation about this.
Okay.
And the way I would approach that as a client, when they say, the vaccines are due, and then the first thing you should be thinking about saying, if you're comfortable saying this, is that, gee, doc, I've got some concerns about the vaccine. Can we talk about that first? And you're going to get one of two reactions. You're going to get a reaction that says, oh, yeah, let's go over that. What are your concerns? But some veterinarians are just going to say, well, they're due. And I don't have time to talk about this with you. Okay. And some of them will just brush that off and say, no, they're just due. And that's what hospital policy put it in those words, right?
Mm-hmm.
And if that's the case, then, and this is the key here, you as a cat or dog owner are in charge of the health of your pet.
Mm-hmm.
You should be able to have input there.
Mm-hmm.
And if the veterinarian can't respect that, then, hey, you got to find one that you can talk to.
Mm-hmm.
Yeah.
So you do have the right to speak up and say, I decline. I do not want to have that vaccine.
Exactly. Yeah.
People just need to be better advocates for their pets. But it's awkward. There's an authority figure that's telling you that they're the ones that went to the school for extra 4 years or more. And it's kind of hard to stand up to that for some people.
Yeah. And they're wearing a white coat and they're, and you call them Dr. somebody rather than, my case, I was known as, for people who got formal at my hospital, I was Dr. Jeff. But most of the time it was Jeff, which is great. I love that. Mm-hmm. But some of them don't have a barrier. And they don't want to do that. So you have to take the health into your own hands. And the biggest part, and this is the biggest part, when a medical procedure is done at a veterinary hospital, you as a client has to have informed consent. So if you're okaying chemotherapy on your dog or your cat, you're supposed to be given all the pluses, the minuses, and then you can make an informed decision and give them consent to go ahead with the treatment. Mm-hmm. How often when you go in for vaccinations are you given informed consent? Do they actually go over the guidelines and tell you about the risks of the vaccination? It's a medical procedure. It's just the same as any other procedure.
Good point.
But at the same time, that also lacks in human land. As I said, if you go in and have a vaccine, they're not going to sit down with you for 10 minutes and go over all the stuff. So if you're thinking about having a vaccine, then find out what vaccine brand the hospital is using. Look up the drug insert, the thing that lists all the things about the medication, and it has all the side effects on there, all the possible things that can go wrong.
Mm-hmm.
So start there.
Yeah, good point.
Yeah.
Okay, anything else that we didn't cover that?
Well, the main thing with all this is that you are the advocate for your dog or cat's health. You're the one that gets to decide what's going on. Mm-hmm. And the thing about the vaccines is that there are side effects. There are things that can go wrong. And the getting on the treadmill of giving them every year, every 3 years or something like that, when you look at the scientific data, it doesn't back up giving them that often at all. So the evidence points that we can go much longer. And I think that's really what we have to start looking at in terms of, hey, guys, why are we doing what we're doing? It's due to tradition.
Yeah.
That's it.
Yep.
That's really it.
Well, Jeff, thank you so much for being here with us today and for sharing this information. I think, like I said, I think people are very confused. They're anxious. They're worried about it. And I think what you've shared today has really helped people to, A, better understand things and better create a plan for how they're going to move forward with their pets.
Wonderful. No, glad to be helpful there, Amy.
All right. Thank you to everybody for listening to another episode, and we will see you next week. Thanks for listening to Muddy Paws and Hairballs. Be sure to visit our website at muddypawsandhairballs.com for more resources, and be sure to follow this podcast on your favorite podcast app so you'll never miss a show. And hey, if you like this show, text someone right now and say, I've got a podcast recommendation. You need to check this show out, and tell them to listen and let you know what they think. Don't forget to tune in next week and every week for a brand new episode. And if you don't do anything else this week, give your pets a big hug from us.